right, welcome back, everybody. So you asked, and this morning we've got answers for you. Dr. I and Dr. J are back to give you some insight on all those burning health questions you've been wondering about when it comes to dental health this week. That's the theme. Today's segment is brought to you by Aspen Dental. Good morning, guys.
Good morning.
I don't think we've talked teeth before. This is new territory for us.
Oral health is health in general.
Exactly.
So
I've had 2 dentist appointments lately, so this has been top of mind for me. Let's get straight to our true and false game. Coffee is the drink that stains your teeth most and causes headaches. Is the drink? I'm going to say true.
That's false, and thankfully it's false because I love my coffee. Yeah. I would have
okay, good, because I have it every day.
Yeah. So no, it's actually red wine. So they did the study where they looked at
Lord,
coffee.
That's also bad.
It is. Unfortunately, right. A lot of people just started to cry in their coffee, right? But they did a study where they looked at coffee, soda, and red wine, and they wanted to see which one stained teeth most. And it was red wine. It went through all 3 layers. It went through the enamel, the dentin, and down to the root, which is where you have your neurovasculature, your nerves and your blood vessels. So it stains the teeth the most deeply, and because it goes to the nerves, it sends signals to the brain that cause a release of serotonin that causes blood vessels in the brain to dilate and causes chronic headaches. So yeah, wine can stain your teeth. And have you
don't tell me that on a
headache.
Friday.
Red wine. Red wine.
What gives?
Go with white wine. This is red wine that they looked at in the study because it has these things called tannins. So just go with the white wine.
No, what are we supposed to? I know you're not dentists, but do we brush our teeth immediately?
That's actually a great question.
Wine?
So in the study, what they found was instead of brushing right away, swish and swallow, wait 30 minutes, and then brush because the acidity will cause you to actually break down the enamel more if you brush right away. So 30 minutes and then brush.
Okay, makes my teeth hurt just thinking about it. Brushing your teeth more than twice a day during pregnancy can increase your risk for preterm labor. I'd say false on that.
That is false. So it's actually the opposite. So dental health is really part of your entire body's health, right? And so what happens is when you're pregnant, you have more blood flow everywhere, including to your mouth and to your gums. And if you have poor oral hygiene, you have this chronic inflammation. It's like a chronic infection, basically. And so your body's like, we've got to fight this infection. And so it makes something called prostaglandins. And prostaglandins are actually very... Prostaglandins.
You learn something new every day.
Every day.
Okay.
And prostaglandins actually are something we give to patients when we're trying to induce labor. So if you have a lot of infection, a lot of inflammation, a lot of prostaglandins, you have a higher risk of preterm labor and miscarriage. So brushing your teeth, good oral hygiene is important always, but especially during pregnancy.
When you're pregnant. Okay. Flossing at least once a week can reduce your risk of having a heart attack. True.
I was going to say, we just gave you the answer to the question. Yep. Oral health is overall health. And so same thing, when you don't floss.
So many people are I mean, myself included, I started using a water pick.
Me too. I love my water pick.
It's easier.
Well, I'm going to tell you the trick. Floss and then water pick. That's what I do. But I'm an overachiever. But no, this is the thing. So, But when you floss every day, basically it decreases the risk of gingivitis, less inflammation, less systemic inflammation, less damage to the blood vessels in the heart, more blood flow to the heart, lower risk of heart attack. And they actually did a study that found that 40% of people who had a heart attack also had gingivitis and oral health issues.
Are y'all one of those when you go to the dentist and they're like, have you been flossing? And you lie to them?
Well, this is the thing. I will always do the water pick and floss before I go. Always.
Yes, and it's the first time you've done it in
like a month.
3 weeks. Yeah. I am guilty as charged. True or false? Seniors should see the dentist at least once every. At least once every 2 years. True.
That's true, but really they should be going every 6 months, so twice a year, and not just seniors, really everybody, because again, we're on the same topic. But when you have poor oral hygiene, you have this chronic inflammation, so you have a higher risk of heart attack, higher risk of stroke, but also higher risk of dementia. And what they found was that in seniors that have lost one tooth, presumably to poor oral hygiene and not fighting or something like that, they have a higher risk of dementia by 50%. Well, cognitive decline by 50%, 20% for dementia. So losing teeth, poor oral hygiene increases heart attack, stroke, cancer risk, and risk of dementia.
Wow, those are staggering numbers.
That's
stats. Yeah. And lastly, teeth whitening strips can accelerate tooth decay. False.
It's actually true. They actually do, yes. And tooth whitening strips have hydrogen peroxide. Hydrogen peroxide kills the good bacteria in your mouth. So you have good bacteria that fight bad bacteria that cause oral health issues. You kill the good bacteria, more decay.
Yeah.
And additionally,
but also you get through the enamel, you get down to the dentin, and that is going to also increase more of the bad bacteria. And it's going to make the teeth a little weaker. And I've got to say, when I used the whitening strips, my teeth were super sensitive, but also that you actually kind of start to get a little translucency to the teeth, because you're breaking down those barriers.
So what, for people who want whiter teeth, do you suggest instead they go and actually get it professionally whitened?
But a lot of times the professional whitening also uses hydrogen peroxide and lights. So what I normally tell people is baking soda peroxide. It's actually an amazing whitening agent, and it doesn't compromise the integrity of the teeth at all.
And brush with it?
Yeah,
swish with it?
Yeah, exactly.
Okay.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.